I want to give everyone an update though on the current status of the pandemic. Data has been a little bit less reliable from my point of view in that there used to be great daily reports put together by the COVID tracking project. And I got very used to the way they presented that. There is still information though. And so I want to at least in broad strokes give you an idea of how things look because there is some good news, although not exclusively good news. So if you take a look at the country at large, as of yesterday, new cases were down to 34,000, which is a 7% decline over the past 2 weeks. So that is good. It's certainly better than the 200,000 plus we had during the dark winter. It is still a lot of COVID that is going around though. And when you bear in mind that some of that is going to be the more infectious kind, and that is spreading rapidly, these numbers again could be affected by the fact that in 2 weeks it's gonna be very different. We don't know, we need to continue to look. New deaths are down to 444 on the 21st. Again, these are Sunday numbers, and so these are always lower than the days around them. It is possible that a 440 death Sunday could result in a 900 death Wednesday. We have to see, but that is a significant decline from 2 Sundays previous. So this is good news, and it needs to be noted. Now we have seen drops like this before though, Francesca, before Thanksgiving, we had gotten down to 500 to 1,000 deaths per day. So, as has been noted, we are sort of watching a race right now between vaccination and the spread of the new, more infectious variants of COVID. Now, on top of that, you could have layered continued social responsibility, social distancing, masking, and all of that. Based on what I'm seeing around the country, I think we're pretty much done with that. It is pretty much vaccinations and a few responsible libs. That's basically it. And so that broad strokes is how the pandemic looks. How do you feel about it?
Bad.
It's less than it was in January.
I'll counter your very articulate summary into feeling bad. Yeah, I mean, yes, I am a little hopeful that, hopefully because of the amount of people being getting the vaccine vaccinated, I don't know. We will eventually get to whatever herd immunity. I don't know. It's taking a while and I don't know, but look, Joe Biden told me that on July 4th, I could grill outdoors with my friends and family, and God damn it, I'm gonna try and get there and do that.
Yeah, and that is, depending on who you are, either an inspiration that if we are responsible by then we might be largely past this, or it can frustrate you so much as a conservative that you like boycott grilling to stick it to them. I don't know, that's apparently what they're gonna do. Now, in terms of overall vaccination progress, the US has fully vaccinated 13% of the population, which is, after 3 months, not the best, but ideally that is the 13% who were, of those who can be vaccinated, and of course not everyone can, those who are most at risk. So fully vaccinating 13% of the population could in theory cut down more than 13% of the deaths, at least expected. A quarter of the country has received 1 dose, and we are seeing a rapid acceleration of the number that are being vaccinated per day. As I think we talked about last week, the initial goal of having 100 million vaccinated under the Biden administration in the first 100 days, they reached that almost twice as fast as they expected. We're shooting past 2 million vaccinations per day. This is all good. However, again, I want to put this in the context of the rest of the world. So if you zoom out and take a look at vaccination rates for the different countries, the US is doing pretty well. There are some countries that have done better. Israel, notably a lot of people have recognized has done more than 50% of their population. You see other countries, including Turkey, Chile, the UK, who've done a lot of vaccinations. There are huge regions of the world though that have done far, far, far less than a quarter as much as we have. And that can be chalked up to a number of different explanations, including some cases of government incompetence. A better explanation generally though is when you can't get the vaccine, it's hard to administer it. When you literally can't buy it, even if you have the money, it's gonna be hard to vaccinate your people. Yeah. And so the progress is not equal around the world, and that is having an effect. So you saw the numbers of COVID cases in the US. They're going down, right? Isn't that great? Worldwide, not so much. Take a look at this. The daily cases around the world are rising significantly around the world, 22% over the past 2 weeks, while deaths remain flat. But if cases are going up, then in 2 weeks, one would expect that the deaths would no longer be flat every 2 weeks over 2 weeks.
And
we're doing better.
No, and first of all, I have so much to say, but the first story about the border crisis and this story are absolutely related in the exact opposite way that Republicans want it to be related. These are the same outlets that throw doubt on the vaccine that are then turning around saying that immigrants are bringing COVID into the United States. Well, that might actually happen if we don't do more to be able to allow other countries to get the vaccine, and more importantly than get the vaccine, to manufacture the vaccine, which is why the World Trade Organization needs to drop the patent protections in this case and in all cases when it comes to human health, right? But that doesn't happen. It hasn't happened with even things like HIV meds, which actually, like, I've said this before on the show, but like the Clinton Foundation has done a good job of like getting like not off-brand, or like manufacturing HIV medicine. But this has to happen now. These are not countries that don't have production capacity. They do. They just don't have the patents and the formulas. Give them the patents and the formulas. It's what the World Health Organization is calling for. It's what nations around the world are calling for. But once again, we want to move toward a xenophobic children of men future where we, just build higher walls and keep anyone out and, make an excuse for more authoritarianism. So we have a choice, y'all. And I think the other thing I'll just say is that the vaccine cannot be your plan for these kinds of viruses. Vaccines they're not a good plan. Like it's great after a year and you can get it. It's too slow. So I hope that the Biden administration is investing in contact tracing, isolation, quarantine, and all of the infrastructural ways that places like South Korea or Taiwan, which has like no COVID, has done an immaculate job at actually stopping the spread because of their previous experience with things like SARS. So let's make sure we beef that up as we move into this hopefully post-pandemic or post-COVID-19 future, with definitely more pandemics to come down the road.
Definitely. Yeah, and I actually watched Children of Men recently, so I get that reference. Yeah, even if, let's say hypothetically, you were willing to do nice things, but only because it benefited yourself. Many of the formulas for these vaccines were created many months ago, long before they were actually approved. That's how they were able to test them. In theory, and much was produced on the assumption that it would make it through, which is why initially we had so many supplies. In theory, even if you were a cold-hearted bastard internationally, you could have made these available for many, many countries to start pumping out vaccine and say, we get a quarter of what you produce in exchange for you getting free access to it. We could have done that. Like, we could have been dicks and benefited more than we actually did. Yeah.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.